Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about maternal health, seasonal allergies, and stroke risk factors. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Sadly, according to the Centers for Disease Control, some 700 women die in the United States every year because of complications due to pregnancy or childbirth, and we're going to talk about that today with Dr. Karen Cassidy, who has been a regular on the program. Nice to see you again.
Thanks for having me.
I know that there was a recent study that came out from Health Grades, is it, and the United Health Foundation on the health of women and children in this country. What did it reveal?
So when we look at the American Health Rankings and what they showed around maternal and child health, we do see a significant disparity between Black women and white women across the country, but also specifically in Tennessee, where Black women are dying in that postpartum period at 3 to 4 times the rate of white women. So it's a really striking and concerning disparity that we're seeing between the two populations.
In 2018, that just seems really hard to believe. What do you attribute that very sad number to?
Yeah, so there actually has been quite a bit of research. It's all pretty early because this has been newly identified, but lots of people are looking into it. And one of the interesting things is it's not related to socioeconomic status or education or even the amount of health care you receive during your pregnancy. It really seems to be a unique issue related to being a Black woman in the United States, and people are thinking this is related to systemic racism and the chronic stress that's caused related to that. People are referring to something called weathering, that chronic stress over time and the toll it takes on people physically.
Because we do know that there are many things that a woman can do even before conception to stay healthy and to, maybe it doesn't ensure, but it certainly can contribute to a healthier pregnancy.
And we strongly encourage that for all women. So, and you know, United has some great programs in place that really support women. We have about 160,000 births for our TennCare population that we support here in Tennessee. And we have a healthy pregnancy program, healthy first steps program, baby blocks program that really look at trying to engage women, all women, in good prenatal care, and then making sure that their infant goes on to have those visits that they need in that first year of life to ensure that they're healthy. But those are really targeting the things that we've always targeted. So good prenatal care, prenatal vitamins, making sure you're eating healthy, not smoking, all the normal things that we encourage moms to do. This disparity really seems to be a unique risk factor for Black women.
So certainly there are programs or ways of reaching the community you're after.
So we're really looking at that right now. So do we need support groups or doulas or other ways of addressing this, or just honestly backing up and looking in general at kind of how we educate and treat women from the time they're very young growing up, particularly minority women, how we support them.
So you're saying it's not lack of accessibility?
No.
Because you oftentimes
even a
think
very educated Black woman who is doing all the right things has a higher risk of death in the postpartum period. And we're really trying to wrap our resources and our collective healthcare mind around what to do to help that population. How do we make that better?
Okay, for whomever's watching the program right now, what are some tips that you can give women of all races to give them a better outcome?
So we tell every woman a planned pregnancy is best. If you find yourself pregnant, get yourself in quickly to have prenatal care. You want to make sure you're engaged with an OB, that you're taking good care of yourself, taking that prenatal vitamin, making sure you're not smoking or drinking during your pregnancy. I think that good overall nutrition, sleeping well, all those things we do for good self-care are really important, particularly when you're pregnant. And then making sure you're engaging with a pediatrician after your baby's born. If you have barriers to care, or you're not sure what is appropriate, there are programs out there. So there's a supportive pregnancy program that all women in the state of Tennessee can access. It was actually a partnership between the March of Dimes, United Healthcare, and the Tennessee Health Department. It's a website you can access. It has supports and things. And then for United members, there's specific programs both for our commercial population. There's a healthy baby program, or healthy pregnancy, program. And then for our TennCare, or our Medicaid population, the Baby Blocks program for babies, for infants, and the Healthy Starts program would be the one for pregnant women to track them through their pregnancy and then transition them to that healthy, or that Baby Blocks program after the baby's born.
Now, talk about the stress, which you've referred to several times, in terms of managing the stress. What would be some exercises, things that
I
the
think
women can
anything
do?
you can do to manage stress is helpful. So whether that's sleeping well, or yoga, or exercise, or having a support group, that's all things that are helpful. Anything that we can do to support women to have good self-care and good stress management is helpful.
Is there anyone you can go to, any other organization that has dealt with this, maybe in other parts of the country, that could lend some support?
So the CDC is really actively looking at this issue. Obviously the professional societies for OBGYN are actively looking at this issue. And also I think all of the, whether you're an insurance company or healthcare provider, this is something very actively on everyone's mind, and people are coming together to have a bigger conversation about it. So I think there will be more to come on kind of how best to proceed and address this. But I think for now what we know is we want women to do everything they can to manage stress and do all those things they know they need to do as far as accessing care for a healthy pregnancy. I think, and the reason I'm kind of stressing that we don't really have a fix to address this, I want to be really careful that we don't say, if you do this, this problem goes away. Because I don't think we can say that right now, and I don't want to give a false impression that women who are dying at a higher rate postpartum aren't doing something they should be doing in their pregnancy. Because I think even when they are doing all the right things in their pregnancy, we're seeing higher death rates in that population.
So frustrating.
It's a terrible problem that we really have got to work hard to figure out.
Thank you so much for coming on, Dr.
Yeah, thank you
Cassidy.
so much for having
Appreciate it.
me.
All right. And we'll be back with a lot more right after this. If you're not one of the 20 million Americans suffering right now with seasonal allergies, well, count yourself pretty darn lucky. Allergist Dr. Alice Hoyt is here from Vanderbilt. What a pleasure to have you here.
Thank you so much for having me today.
Now, I know that so many people are sneezing, sniffling, coughing, runny nose, eyes itching, you name it. But it's not just this time of year, sometimes it's year round.
Right.
So for this time of year, what are the triggers, Dr. Hoyt?
So trees and grasses, as you can probably tell by looking at your car, all of the pollen, not just your car, lots of cars on the road, they're just covered with pollen because it's finally becoming springtime and trees are starting to bloom and spread their pollen so that they can procreate, and grasses are starting too. And those are the things right now in the springtime that folks become allergic to and are allergic to.
But then there are allergies, obviously, that people suffer from year-round.
Yes.
And I guess a lot of people really wonder, am I sick? Is this something more than, a simple allergy? How do you know when it's something more serious?
So if someone's having fever, chills, throwing up, those symptoms are not consistent with allergy. When we think of allergy, we think of itchy, drippy, sneezy, you feel full and congested, coughing, drainage, those types of symptoms that make you feel miserable, but not necessarily having the fevers and the chills. Those would be signs of infection. And you're exactly right. We can have those symptoms year round because some patients have perennial allergies, meaning more year round, and they can be allergic to cats. And so they might not have a cat, but maybe their coworker has a cat. And cat dander gets on the clothes, and then the coworker says hello and breathes in that cat dander, and the sniffles begin.
That's simple.
It is that simple.
Vulnerable.
It can, absolutely.
Okay, so you've gone over some of the symptoms. As far as treatments, I think most people are getting over-the-counter medications. I was thinking about this before the interview. Is there the possibility that over time, when you're using these over-the-counter meds all the time, that you develop an immunity to them and they quit working?
That's a good question. We hear that a lot. Generally, no. Generally, what will happen is that your symptoms will get better, and then you're like, oh, my symptoms are better. And then you stop the medicine, and then they come back. But generally, developing an immunity doesn't so much happen. It's really patient dependent, though. So if you were to come to me and say, you know, Claritin really works, but then it kind of stops working, then I would say, okay, let's do an antihistamine carousel, meaning you use Claritin for 1 month, then you switch to Allegra, then you switch to Zyrtec, and you sort of rotate. So we really try to tailor our recommendations to the patient.
All right, very individualized.
Absolutely.
Can you develop allergies at any age? I've heard that you can, and so many people complain. They say they moved to Middle Tennessee, and all of a sudden, they get allergies. They've never had them before.
Must have been in my clinic this morning.
I was there. No, I wasn't. But yeah, that's a familiar story.
Absolutely, that's a familiar story, especially with so many people moving to this exciting city. Usually, you know, maybe they've been here a year or so and they're like, man, it's springtime and I just can't take it anymore. So yes, really at any age you can develop these seasonal allergies.
Okay, so how do you know then when it is time to see a specialist? You treat it, but then it progresses, and is the fever one of the key things then?
Fever is not allergy.
Okay, that's not allergy.
There is what's called hay fever. Hay fever was first described, which is the same thing as allergic rhinitis, but that was first described really in the 1800s when all of this started happening. Looking back at biblical days, there wasn't allergy. Allergy is a very new disease, and so
I didn't realize that.
Yeah. I know, right? It's a very new disease, just like food allergy, just like asthma. They're new diseases, and we think they have something to do with our improvement in hygiene. Hygiene, very, very good, but we think that something about hygiene is sort of changing the immune system or changing the way our bodies respond to the environment. That is under significant investigation right now because allergy is a multi-billion-dollar business.
I'm sure it is.
And so that's why really if somebody's thought about seeing an allergist, I really encourage them to call, make the appointment, because what we can do is we can identify what they're allergic to with either skin prick testing or blood testing, so that then we can give them a very personalized, tailored plan for when to take what medication, because the allergy aisle is confusing.
It really is.
Everything says allergy cold, allergy sinus, sinus congestion, and reading the names of the individual actual medications, that can be very, very challenging even for physicians. So if you don't have a really good plan from a specialist, it's easy to sort of waste money at the pharmacy.
Great points. Are there ways you can decrease your exposure?
You can decrease exposure, but a lot of those ways mean staying inside and closing windows. And we don't want to do that, no. And that's why you can see an allergist, so that we can work together as a team, take control of your allergies, treat the symptoms so that it doesn't affect your life.
Allergic sinuses, I probably shouldn't be jumping off into that area, but that is part of this as well, isn't it? Sort of a subset?
Yes.
More severe? Problem, or
in a way, yes. So patients who have sinusitis, itis meaning inflammation, sinus meaning these sort of air pockets in our faces, they can fill with goop and inflammation, and sometimes that is associated with allergies, meaning your body sees tree pollen as a foreign invader and it's trying to attack it. And when you get continual inflammation in your sinuses, that can certainly set you up for infection. And so we will actually ask patients, how is your sense of smell? Because if your sense of smell is decreased, then we're thinking that those allergy cells that come along with inflamed sinuses are actually secreting a little nerve toxin and making your sense of smell go down. So that's a common question that an allergist will ask you to help determine if your sinuses are involved.
Sense of smell. All right, interesting. So where can we find out more information? Is there a resource for folks?
Yes, so always come to Vanderbilt Allergy, Google that, you'll find our website, but also look at our big academy, so the American Academy of Allergy, Asthma, and Immunology, and the American College of Allergy, Asthma, and Immunology. But I can't more strongly recommend talking with your doctor, coming to see an allergist so we can get you a really personalized plan.
Okay, very eye-opening. Didn't realize this was really a new kind of illness and disease.
Yeah.
Thank you so
Sure,
much.
thanks for having me.
Happy spring and summer.
Thank you, you too.
Okay, and we'll be back with more right after this. Thank you. Stroke is still the second leading cause of death in this country, and actually up to 80% of strokes can be prevented if people maybe were more aware, were taking better care of themselves. Dr. Davik Pratt from St. Thomas is here to talk about this.
Yeah.
Glad to have you in.
Thanks for having me.
But unfortunately, it seems like we've been hearing these numbers for a long time. Why is it still such a leading cause of death?
Well, it's a leading cause of death because stroke is caused by the leading crises in healthcare in America, including obesity, diabetes, high blood pressure. And what we have seen, unfortunately, is an increase in the rates of obesity, especially in young people. So the childhood obesity epidemic is now leading us to seeing people have strokes at younger ages, and thus the rate of stroke, which used to be considered an old person's disease, is really increasing leaps and bounds.
What exactly happens in a person's body when they're suffering a stroke? And I know there are different types of stroke.
Yeah. So there's two major types of stroke, and there's one where there's a loss of blood supply to an area of the brain, and because blood is important for the brain's survival, when you block blood supply, the brain then becomes injured, and eventually those cells in that area die, leading to stroke. And that's the most common type of stroke. The other type of stroke is what we call hemorrhagic or a bleeding stroke, where you have an acute bleed or blood in the brain that leads to the same kind of damage and a stroke as a result.
So what would the immediate symptoms be?
So symptoms can vary, but we really talk a lot, and I know you're going to bring this up later, about sort of the FAST acronym, which we've been using for years and really are trying to get the word out. In either type of stroke, patients can have an acute onset suddenly of facial weakness, weakness of one arm or one leg on the same side, difficulty with speaking. Strokes can have associated confusion, headache, but really we're looking at, do they have a weak face? Are they having trouble speaking, whether it's they can't find the right words or they have slurred speech, or is one side of their body weak in comparison to the other?
If you're alone, what do you do and these symptoms come on?
Well, if you are alone and that happens to you and you're still able to, or capable of picking up the phone and dialing 911, that's absolutely what you should do. A lot of our patients sort of say, well, maybe if I wait an hour, it will go away.
Go back to bed, roll over.
Right,
Don't
and
do
we
that.
hear that so many times. And I think the advancements in stroke medicine really need to shift patients coming earlier, because there are acute treatments that we can give patients to reverse the stroke. So we're really trying to educate people. If you see somebody that's having symptoms like that, or you yourself or a loved one, family member, somebody on the street, you should be calling 911. You shouldn't be waiting an hour to see if it goes away. And certainly don't get in your car and drive. Just have the ambulance come pick you up.
Because the time is brain power,
Imperative,
right?
Time is brain.
Time is brain.
Yeah.
You can save some of that brain
Absolutely.
tissue.
Absolutely.
Whatever. Okay. Now, what are some of the risk factors? You've mentioned obesity, but what are some of the other risk factors we need to know about?
Yeah, so diabetes, high blood pressure, obesity, those all run in hand, and those are really the most common risk factors. Another one we talk about a lot is smoking. Unfortunately, even though the rates of smoking have decreased, there's still a lot of people out there that smoke, and that causes blood vessel damage. People who have cardiac issues, atrial fibrillation is one of the most common cardiac arrhythmias that leads to people having stroke. Family history, obviously.
Yes.
That's not necessarily a modifiable risk factor, but certainly can be.
Okay, also I see here excessive, can you pull that screen up again with the list? Thank you. The excessive alcohol intake.
Yeah.
So how often is that related? Do you have stats on that?
I mean, I think alcohol in and of itself, people who have alcoholism, they are at risk for a couple of different things. First of all, often nutritional status is not really all that great in people who consume large quantities of alcohol. I think that alcohol can be associated with exacerbation of blood pressure issues and diabetes. And then in addition, people who do abuse alcohol, their brain tissues can become a bit more friable. So they can have bleeds, they can fall down, leading to bleeds.
Sure.
So alcohol in and of itself, in moderate and low quantities, we don't consider that to be a major risk, but obviously consumption of anything in excess is dangerous.
So let's go over some of the treatment modalities then. Of course, if you get to the emergency room fast enough, are they giving you, is it TPA?
Yes, that's correct.
And explain what that is.
So TPA is a clot buster. So that's what it does. If you come into the emergency room and you have signs of a stroke, the neurologist or emergency room physician will make an assessment as to, what they think is going on, and you'll get a head scan to make sure you don't have bleeding, because obviously we don't want to give a powerful blood thinning agent to somebody that has blood. And within a 4.5 hour window, we can provide this medication TPA. And it's meant to break up the clot, because we think there's a blood clot sitting up there that's leading the symptoms of stroke. And if you can dissolve that, then you open up that vessel and provide opportunity for the brain to get blood supply again.
Okay. What are the chances of having another stroke if you've had one, of another one occurring?
So high. I mean, I think that one of the risk factors of having another stroke is having one stroke. And we see that if people do not modify their risk factors, or they don't really take into consideration all of the things that we've discussed, and we see that, unfortunately. I think it's easy to say change your diet, take your blood pressure medications, but life is difficult, and I think sometimes people want to do the right thing but just can't. And there are resources available for people. There's the National Stroke Association, there's the American Stroke Association, St. Thomas has a stroke program, and certainly education is available for patients who need help.
Thank you so much,
Thank
Dr.
you.
Pratt. I
Thank
really
you for having me.
appreciate it. As always, thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.